$9 billion can buy a lot of silence. It couldn't buy accuracy. Imagine you're a grocer, not a doctor. If your scales are off, the apples get mispriced, and someone grumbles at the register. In medicine, a bad scale doesn't cost cents. It warps diagnoses, therapies, and life-altering choices. That's the heart of the Theranos story. Not a scrappy startup that merely stumbled, but a governance ecosystem that allowed an unproven diagnostic instrument to seep into clinics while projecting the aura of a fully validated device. The promise was irresistible: fast, affordable blood tests from a finger prick, and the market provided oxygen. Retail pharmacies were racing to rebadge stores as care destinations. Consumers were primed for convenience, and investors had learned to equate big mission statements with inevitable success. Rules existed, but they ran in parallel lanes. Laboratory operations in the United States fall under the Clinical Laboratory Improvement Amendments, while the Food and Drug Administration oversees devices and certain tests. Contract partners bring their own risk processes. State attorneys, general patrol advertising, and consumer harm. In the gaps between those lanes, Theranos built a narrative that looked like the future and a lab reality that couldn't keep up. The principal actors each held a crucial lever. Elizabeth Holmes, founder and chief executive, crafted the story, set the tempo, and controlled external access to the technology. Ramesh Sunny Balwani, president and chief operating officer, gripped operations, engineering sprints, lab throughput, schedules, and enforced a culture where dissent met friction. A celebrated board lent geopolitical gravitas rather than bench science skepticism. It soothed outside nerves, but rarely cornered the hard technical questions. Walgreens was the retail artery that carried the concept to real patients. Its in-store wellness centers, turning a theoretical device into a consumer experience. Inside the lab, directors lent their signatures and credentials to a quality system tasked with converting fragile assays into reliable results. Around them moved clinicians and patients who experienced the output without seeing the inputs, and a ring of regulators, centered on the Federal Lab Agency and the FDA, who intermittently inspected, asked for records, and eventually acted. The press, when it finally pierced the veil, became the only control, with no contractual incentives, to keep the story whole. The chronology that matters begins not with a dorm room pitch, but when patient samples began moving through a system marketed as a revolution. Theranos rolled out retail testing in Arizona, even as its proprietary Edison devices were limited or cleared only for narrow uses. Public-facing materials implied breadth. Internal reality was narrower and far less stable. By late 2015, investigative reporting surfaced allegations of split sample maneuvers in proficiency testing and widespread reliance on conventional analyzers hidden behind branding that suggested otherwise. In early 2016, federal lab inspectors documented quality control failures, problems with proficiency testing, and conditions they said placed patients in immediate jeopardy. That summer, sanctions arrived. The main lab certificate was slated for revocation, and Holmes was barred from operating a clinical laboratory for 2 years. Walgreens terminated the relationship and shuttered the in-store service. In 2017, Arizona secured consumer refunds for tests it alleged were unreliable or advertised in ways that broke the rules. The next year, securities regulators alleged that investors had been misled about capabilities, revenue, and partnerships, and federal prosecutors charged Holmes and Balwani with fraud. Trials and verdicts followed, and the corporate entity ultimately dissolved. The arc is not about a device that failed to meet hopes. It is about controls that failed to check claims before those claims shaped medical decisions. Operationally, 3 mechanics locked together. The first was a marketing engine that promised a step change. Hundreds of assays from a few drops, while the internal test menu that truly ran on the proprietary platform remained thin and temperamental. To keep the promise visible at retail scale, much of the practical testing ran on commercial analyzers, sometimes modified, often obscured behind process curtains. The outward signal implied a proprietary revolution. The inward reality depended on legacy machines. The second was a compliance choreography that treated oversight like a geometry puzzle. When proficiency testing threatened to expose device performance against established methods, Samples were allegedly split or routed in ways that insulated the Edison from direct comparison. When regulators demanded validation, management presented selective studies, narrow clearances, or bespoke runs that did not reflect full clinical diversity. The third was cultural. Decision rights centered at the top. Cross-examination of data was unwelcome. Employees who flagged drift, dilution shortcuts, or stability concerns encountered pressure or legal threats. In such a culture, quality system becomes a binder, not a brake. Incentives steered these mechanics. Capital was raised on ubiquity, national retail rollout, implied use in demanding settings, a test menu that would unlock consumer demand. Valuation tracked belief rather than verification. Inside, success metrics tilted toward growth optics. More stores lit, more samples in, a broader advertised menu, and a cadence of announcements that suggested relentless progress. Slowing down to fix an assay or narrowing the menu to what was truly validated threatened every relationship that depended on momentum. Leadership prestige and compensation depended on narrative continuity. Partners needed customer stickiness and differentiation. Investors wanted to be early in a category-defining winner. When the scoreboard rewards footprint and press, a lab becomes a brand first and a scientific instrument second. In that environment, the dull discipline of method comparison, external validation, and failure triage looks like an existential risk rather than the only path to safety. Controls existed, but they were angled. The board had luminaries who knew statecraft and defense, not calibration curves and interference studies. They were well suited to open doors and poorly suited to interrogate limit of detection claims. Internal lab leadership carried legal obligations, but struggled to assert independence in a secrecy-first culture. A truly independent lab director can halt testing when quality control charts drift. That authority is hard to deploy when organizational oxygen flows from expansion goals. Walgreens' diligence did occur, but much of it relied on management-curated data, guided tours, and short windows into complex systems. Partner endorsements then fed a halo loop that validated the company's story to other stakeholders. The split authority of U.S. oversight, labs under the federal program, devices under the FDA, created room to lean on the lab-developed test framework, while marketing like a device. None of this absolves responsibility. It maps where the guardrails bent. When enforcement finally landed, its vocabulary was precise. Federal lab regulators did not allege a mere mismatch of ambition. They documented quality control excursions, proficiency testing irregularities, and conditions they labeled dangerous to patients. And they imposed sanctions that are severe by laboratory standards: certificate revocation, civil penalties, and a bar on the chief executive operating a lab. State authorities secured consumer refunds for Arizonans who bought tests during the retail rollout. Securities regulators described a pattern of investor deception, overstated menu and accuracy, implied military use, and revenue claims that conflated pilot activity with durable business. In parallel, criminal prosecutors argued that leaders knowingly misled investors and, in certain counts, patients. Juries agreed in separate trials. Each action sat where it belonged in the U.S. framework: the lab agency for clinical practice, the device agency for test claims, the securities watchdog for investor truthfulness, the state for consumer harm, and the Justice Department when alleged deception becomes crime. The mosaic is important. It shows that no single cop on the beat was enough. Only when all arrived did the picture lock. The people most affected rarely got the microphone. A patient in Arizona may have been told she was miscarrying based on an HCG result later voided. Another saw a potassium value so high it would terrify any clinician, only to learn it was a sample or method artifact. Even when tens of thousands of results were voided, the anxiety, follow-up tests, and sometimes invasive procedures could not be rewound. Physicians had to re-anchor clinical judgments, reconcile discrepant results, and explain to patients why confidence collapsed overnight. Retail staff faced confused customers and reputational blowback. Employees who raised alarms bore legal costs and career risks that didn't vanish when the company did. Investors lost money, but the broader harm was paid by public trust. Innovators with genuine breakthroughs now face a skepticism tax. Every grand claim meets a longer diligence list because one company used ambiguity as a business model. There are practical signals to read earlier next time. Treat independence as a non-negotiable. If a company claims step function gains in diagnostic accuracy or breadth, demand blinded head-to-head comparisons against gold standards run by independent labs with clinically diverse samples. Ask to see distribution tails, not just mean error. Bad medicine lives in the tails. Follow jurisdictional lines. When a pitch leans on being a lab to bypass deeper device review, but markets like a device to consumers and partners, that is a governance red flag. Read culture as data. High turnover in scientific roles, top-down control of who sees raw performance, and reliance on non-disclosure threats rather than transparent rebuttals correlate with technical fragility. Probe partner diligence rather than taking endorsements at face value. If a retailer's sign-off rests on slide decks and escorted site visits rather than independent sample sets, the logo on the window is not a safety seal. Finally, interrogate the KPIs. If leadership brags about footprint and press cadence while downplaying assay stability, method comparison, and error flags, incentives are misaligned with patient safety. Boards need a different mix when science is the product. Prestige opens doors. Expertise prevents disasters. Directors must be able to debate the chief scientist on assay drift, matrix effects, and interference. Committees should own technical risk and retain independent advisors who report to them, not to management. Compensation should reward milestone evidence, successful method comparisons, external validations, and clean proficiency testing, not just expansion. If leadership resists those terms, the problem is not a board calendar. It is governance itself. Clinicians and patients can practice defensive optimism. New services can be extraordinary, but when a result clashes with the clinical picture, order a confirmatory test using a different method. Ask what platform performed the assay, and whether that method has external validation beyond the company's own studies. Convenience is valuable. It is not validation. The friction of a second draw is cheaper than a cascade of misdirected treatment. What happened at Theranos was not an act of fate. It was enabled by a market eager to be disrupted, by partners who prized first-mover glow, by a governance structure allergic to friction, and by a regulatory architecture with seams. When guardrails presume good faith, bad faith looks like creativity. The answer is not to strangle innovation. It is to demand that extraordinary claims clear ordinary checks before lives are touched. If this kind of sober, forensic storytelling helps you separate signal from hype, share the episode with someone who loves the next big thing in health tech. And if you want more grounded investigations into finance, fraud, and the governance failures that enable both, subscribe so you won't miss what's next.